While a balanced diet should ideally provide all the necessary vitamins and minerals, some individuals with IBS may have difficulty absorbing or tolerating certain nutrients due to their symptoms or dietary restrictions. In such cases, supplementation with specific vitamins may be beneficial. However, it's essential to consult with a healthcare professional before starting any new supplements. Here are some vitamins that are often considered for IBS patients. Number 1. Vitamin D. Adequate vitamin D levels are important for overall health, including immune function and bone health. IBS patients may have a higher risk of vitamin D deficiency due to dietary restrictions or limited exposure to sunlight. Supplementation can be considered, particularly if blood tests indicate low vitamin D levels. Number 2. B vitamins. B vitamins, including B12, B6, and folate, are essential for energy production, nerve function, and the formation of red blood cells. IBS patients may have reduced absorption of these vitamins due to intestinal malabsorption or dietary restrictions. Supplementation may be recommended if deficiencies are detected through blood tests. Number 3. Magnesium. Magnesium plays a crucial role in muscle relaxation, including the muscles of the digestive tract. It can help alleviate constipation and muscle cramping in some IBS patients. Magnesium citrate or magnesium oxide supplements may be considered under the guidance of a healthcare professional. Number 4. Probiotics. While not technically a vitamin, probiotics are beneficial bacteria that can support gut health. They are available in supplement form and can help rebalance the gut microbiota, potentially reducing IBS symptoms such as bloating and irregular bowel movements. Look for probiotics specifically formulated for IBS or consult with a healthcare professional for appropriate strains and dosage. Number 5. Omega-3 fatty acids. Commonly found in fish oil supplements, have anti-inflammatory properties and may help reduce intestinal inflammation associated with IBS. While evidence for their effectiveness in IBS is limited, some individuals may find them helpful in managing symptoms. Remember, it's important to consult with a healthcare professional before starting any new supplements, as they can provide personalized recommendations based on your specific needs, symptoms, and medical history. They can monitor your progress and adjust dosages accordingly.